We're at the Mackinac Policy Conference on behalf of the Michigan Health and Hospital Association. This is Rich Helppie, your host of the Common Bridge. And there's a lot of linkage between healthcare and education. And with us today from Western Michigan University is the president of Western Michigan University, Mr. Russ Kavalhuna. Russ, welcome. Glad to have you here. How's the conference so far?
Thanks, Rich. Good to see you. The conference is great, as it is always. Got some serious problems to solve in Michigan, and like every year here, the serious problems are front and center. And one of them is workforce in healthcare. So I'm excited to chat with you and your listeners about it.
Great. What is Western Michigan, which is known for many good things, business, aviation, other practices? What role is Western Michigan playing for healthcare work?
Well, we've got a couple things we're working on, and we're building on a foundation that's pretty solid. That foundation, we do have a college of undergraduate training in all the allied health programs. That's the College of Health and Human Services. And then, of course, 15 years ago, we started a medical school called WMed, which is doing really, really great work. It is cutting edge in its technology. In fact, we get over 5,000 applications a year for a class of 88 in that medical school. And then you may know that about 20 years ago, philanthropic leaders of Kalamazoo built something called the Kalamazoo Promise, which tells any student like my children who are attending Kalamazoo Public Schools that if they find their way to higher education, the tuition is paid for. And so one of the things we're excited about trying to link together is this idea that a healthcare talent pipeline could exist in Kalamazoo, starting in 8th grade, where we would talk to students about ways that they can have real meaningful careers in healthcare, moving them through high school into one of our community colleges in our region or our university. And then what we want to do is find a path, and we're hopeful to announce this, that if you do well through high school and higher education, whether it's community college and university, that you're guaranteed a spot in those 88 seats in a medical school that, as I say, draws international applications in the thousands. And so we're hopeful to be one of the first communities that says this community wants to build healthcare talent from middle school all the way to the local medical school.
Well, staffing is clearly an issue in healthcare from every perspective, whether it's physicians, whether it's nurses, whether it's radiology techs, lab techs, etc. And Western Michigan's a place people that are there want to stay. They want to have a good quality of life, and that includes, of course, healthcare and education. How have you found the health systems in the western part of the state in terms of cooperating with Western?
Well, that's one of the foundations that we think that this healthcare talent pipeline can be built upon. We have two independent healthcare systems. One's Bronson, and one used to be Borges, then was bought by Ascension, and now is bought by Beacon. And those two healthcare systems, Bronson and Beacon, are actually partners in the formation of the medical school. So the university, Western Michigan University, Bronson, and Beacon have come together and are delivering a medical school for our region. Now, Bronson itself has fought this trend of consolidation in healthcare systems. In fact, it's independent and has grown itself in our region. Beacon is a new player in our community, but they're working together. Another unique aspect is that they are collaborating with our medical school. So our view is that if you do want to find your way to Southwest Michigan, unlike many regional towns in the Midwest, you're going to find two independent, fully staffed hospital systems and a local university training allied health all the way through specialty medical school.
And as far as the business community is concerned, this is a business conference. How often does healthcare come up as a topic in your dealings with them?
Well, it's primarily the number one topic, probably other than housing and partisan government. Those issues, housing, partisan government, and healthcare. Those are the real issues that business leaders are facing. The Bronson healthcare system has a CEO who happens to be the chair of the MHA. So he's a national level leader that is the CEO of our one of our hospital partners. And if you're an employer, whether you're in healthcare or not, you do realize that you cannot attract talent without a serious medical facility or multiple serious medical facilities. And like I say, with two hospital systems in a town of 100,000 people, which is what Kalamazoo has, and a research university and a medical school, excuse me, that's something that most employers can't say they have. And of course, Kalamazoo also has Fortune 500 companies based there. So, but healthcare and the talent pipeline of healthcare is going to be one of the huge things we've got to solve because, as you know, our population is aging. My generation, Gen X, is so much smaller than the baby boomers. And the real question is, are we going to have enough talent to service the needs of a growing quadrant of citizens who are aging into the end of their lives?
Indeed, and the fastest growing segment of the population, percentage-wise, over 100, and people are being able to live longer, and also getting into very important conversations about quality of life, and so much spending, of course, in healthcare is in that last year or 2 years of life, and making that spend smart. These are very complex things to unravel, and I'm glad that Western Michigan University is stepping up to the challenge. Now, Western's also always been noticed as a great place for occupational therapists, physical therapists, and so much of medicine now is looking at dealing with the musculoskeletal system. How's that? How are things going with those colleges?
So the OT and PT are in our undergraduate college. And what we're really excited about is exactly what you just mentioned. This question of are we as a society going to handle healthy aging? And we think that there's an opportunity for our research basis, and we're right on the cusp of becoming an R1, which is the largest classification as a university. Not quite yet there, but we're probably going to be there in 1 or 2 years. We want one of the cornerstones of our research to be around healthy aging. And that's a great way to link both PT, OT, and all the allied healths that are supported by associate degree and bachelor's degree level education, coupled with university research and geriatrics at the medical school level. And we have all those pieces. We think if we attract the right kind of foundational support for that kind of research, and we are going to do that, then we can be a model not just for Michigan, but for the region of how to handle aging population in this do better as you age versus, as you know, just 50 years ago, we didn't do this very well because people didn't live that long, and they didn't live that long kind of moderately healthy. We have people living longer and moderately healthy. And if we start doing really good research on that, we can say to our children, hey, we built a system for you to help me live a little bit more healthy, a little longer, instead of longer unhealthy. And that's one of the things we want to lead on.
Indeed, and it keeps people out of the acute care setting, which is the most complicated, most expensive, requires the most staffing. And of course, some people, through no fault of their own, are going to fall into that system and of course, benefit from the extraordinary care. Are there any policy matters that you're hearing discussed here that are particularly intriguing or perhaps scary?
Well, one thing that I'm ambitious about, that I've been trying to talk to policymakers for 2 years now, is something that I studied when the governor put me on the Growing Michigan Together Council. And that was an idea that we needed to deal with the fact that Michigan was losing population generally. And one of the things we proposed was a process to say to students in a talent pipeline, if you matriculate from college and get a job, there's an incentive for you to put down roots and stay in Michigan. And so what we're hoping to do is, as I mentioned, build a pipeline of students from the local high school to the local higher education institutions through the medical school and into these two hospital systems. And then with a job there, our goal would be to say there's a financial incentive for you to stay and have the state and employers help that. And that might look like a bonus, so to speak, to help with a down payment, or to live down a little bit of college debt, or for the employer to be relieved from some of the payroll taxes. States around us have done this successfully, and we think that's something that we will show the state of Michigan as a proof of concept that Kalamazoo has the right pieces to build.
Wonderful. Any final comments for the audience?
Well, go Broncos.
Well, go Broncos. Great place to end.
And, I'm a product of this healthcare. I was born in Bronson Hospital.
Is that right?
And I'm still really proud of it.
Very good. Well, best of luck as you continue to grow Western Michigan University and the greater Kalamazoo area. This is Rich Helppie, host of The Common Bridge, on behalf of the Michigan Health and Hospital Association, and speaking with Russ Kavalhuna, the president of Western Michigan University.